تمام. Good afternoon, everybody, and welcome to this webinar, First Aid and CPR Overview. It's one of the events this day, 12th of September. It's considered World First Aid Day. Okay. We'll have a few minutes until we have more participants in this webinar. Okay. Now, World First Aid Day, it's an annual campaign to promote the importance of first aid training in preventing injuries and saving lives. Every year, the second Saturday of September is observed as World First Aid Day. This year, in 2021, the day falls in September 12th. Now, in this webinar, our objective to empower people to help the victims as much as they can quickly and safely. Why I am emphasizing this quickly and safely? Because most of the people want to help, but sometimes they help unsafely. Maybe they harm themselves or others. And sometimes they're rushing quickly, unsafely, and sometimes they are more safely and they are not doing quickly action. First aid is the first action you need to do it for any patient or any victim. So we need to balance these terms, quickly and safely. Of course, how we do this balance, we know the first aid primary skills, which is finding the problem. We'll speak about it later on. Knowing how to act in case of medical or injury emergency. Sometimes when you are with your friend, you said, okay, if something happened, what I should do. This is what will take you up many topics, such as heart attack, how you will deal with it. Hands-only CPR, especially in this pandemic. During the pandemic, did I need to give a breath or not? How I will do and perform hands-only CPR. When and how, when I decide to start and when I decide to stop. And of course, knowing the importance of using of AED, automated external defibrillator, and how to run it. Now, this is our objective. Let's see our agenda. First, I will talk about finding the problem. And next, we'll talk about medical emergency. We'll show some cases about medical emergency and how to do first aid for it. And of course, injury emergency. And we'll talk about a CPR, the cardiopulmonary resuscitation, and hands-only CPR technique. And of course, we'll conclude it with the automated external defibrillator. Now, finding the problem, why it's considered the primary skills of the first aid. Finding the problem, it's the most important skills because in these skills, you make your priorities. Your priorities first. If something happened, you witnessed somebody collapse in front of you, or you didn't even witness it. What to do if you see somebody lying on the floor? What you need to do? How you need to act quickly and safe. First thing, first thing, need to make sure the scene is safe. What about your feelings? Before you check the scene is safe or not, you need to make sure that you try to hold yourself. Try to not get panic. People in real life, they get panic easily. When they say somebody is bleeding, somebody has a heart attack, somebody collapses in front of them, they are panic. So what I need to do, I just give you 5 seconds to get panic. After that, you need to hold yourself. Because when you are not holding yourself, you are not useful for yourself or for the victim. So try to hold yourself. While holding yourself, you need to assess the scene. The scene is safe or not. The scene is safe for you, first place. Second, to the victim, second place. You need to assess. You need to use all your senses. Your eyes, what you see. Your ear, what you hear. Your nose, what you smell. And of course, your feeling. Don't ignore your feelings. Sometimes your feelings say, don't enter, don't enter. What you need to do, if you cannot enter, the scene is not safe, immediately I will call. This is what all about. This is what I emphasize all the day. If you cannot control, if you get panic, if you cannot control your feelings, if you cannot do what to do, always call. Early call make the difference. Early call make the difference. Regardless, maybe they will respond after 5 minutes or 1 hour. Early call make the difference. Make something you are, as a first rescuer, do at least early call. Make the difference. So make sure the scene is safe. The scene is safe, I approach the patient. If I witness the patient in front of me collapse or have a car accident or he falling down or anything, I witness what happened to him, I am entitled to call emergency number to activate the emergency response. This is I am entitled of. But if I come into the room and I saw somebody lying on the floor, I need to check his responsive, if he responds or not. How I will do that? I will tap on his shoulder and I will shout loudly, are you okay? Tap and shout, are you okay? If the patient open his eyes or give any noise, that means he is conscious. He is conscious. He is in pain or he is confused, but still he is conscious. That means his heart is beat. His heart is working. His breathing is working. Now you ask him, what happened to you? Maybe he will tell you, I am tired. I need help. He will tell you. But in case you tap and shout, and he said no response at all, nothing at all. In this case, this is very important. You need to activate the emergency response. This is your trigger to activate the emergency response. The patient, when you tap and shout, are you okay, is not response, this is the time to call 911. If you are alone, you need to shout for help to determine that you are alone or not. Help, I need help. If somebody come to you and tell you, yes, what can I help you? You need to tell him, please, call 911 and get me the first aid kit and the AED. You need to ask him to call 911. If you shout for help and nobody answer, you need to do it by yourself. You need to put the phone on the speaker and you call 911 and start to report. And never hang up until the dispatch will tell you, okay, we have received your message, your report. So this is the way early call make the difference. Now, when we call, we tell them exactly what he need to know. You told him there is a patient, you give him all the reports and you answer his question. And of course, don't hang until what? Until he tells you it's okay to hang up. Now, we'll check the breathing. Now, as you know, we all breathing from our lungs, but we are here looking for the breathing movement. When see the movement of the breath. In the ladies, most of the breathing movement will be in the chest, in the upper chest. In the gentlemen, most of their breathing movement, it's in their abdomen, in their belly. But in the child, the chest and the abdomen goes together and back together up and down symmetrically. That's why while you are watching and check the breath, you need to scan him from neck to abdomen, abdomen to neck, 5 seconds, but no more than 10 seconds. You need to take care that you need to spend 5 seconds. Trust me, guys, in real life, you invest in 5 to 10 seconds, you invested that to see if the patient is breathing normally or not. When you see the patient is normal breathing, that means no gasp, no snort, no snoring, no any kind of voice, and then the chest goes well, very smooth, and goes back very small, very smooth. This is considered normal breathing. So you spend 5 to 10 seconds and invest this time to check his breathing. Trust me, guys, in real life, whatever the patient is near to you, you are more panic and you are more stressed. Then, so when you do this and you check his breathing 5 to 10 seconds, exactly 5 to 10 seconds, and you realize in real life he is breathing, your stress goes from up to down immediately. That means he is alive. So when you check the breathing, take your time. But if you confuse or you are not can check the breathing in a proper way, consider him as not breathing and start for him CPR. And I will talk about this when we hit the CPR page, inshallah. Now, I check for his breathing. He's breathing normally. That means he's alive. So I will check what caused his become unconscious. You scan the victim from head to toe, looking for the sign of injury or medical injuries. You scan him. You see him from head to toe to see if there is any injury. What we are looking for? We are looking for burns, sites, broken bone, or we looking for bite sites or bleeding. So remember the 4B: bleeding, broken bone, bites, and burn. But if the patient is not breathing normally or only gasping, this is the time to start for him what CPR. You see, this finding the problem, skills and steps, it's easy to say, but they need practice. They need practice. So I'm really, encourage you to take a snapshot for this and remember it. Remember it, finding the problem. Now let's go to the other topic, medical emergency. In the medical emergency, we'll talk about heart attack, we'll talk about stroke and low blood sugar. As a first aid risk one, what you need to do in these kind of things. Heart attack, what happened? There is a clot. It will be completely block the artery or partially block the artery. This will cause heart attack. It will go with this symptoms such as pain or discomfort of the chest, lightness, lightheadedness, nausea or vomiting, pain in the jaw, neck or back, discomfort of pain in the arm or shoulder, and of course shortness of breath. In the ladies, mostly they have this additional signs and symptoms. They have what they call it a gastric pain. What they call it, the stomach, the upper stomach, it will be like very painful and feel like indigestion, like this. She cannot have a proper breath, and she has really pain in the stomach. This is considered one of the significant signs of heart attack with the ladies. What about what to do? If somebody have this sign and symptoms, what you need to do as a risk? Make sure the person stay calm and rest. The most important thing in the heart attack, you need to be rest and stay calm. We saw many things. It's really spread in WhatsApp and Facebook and social media in general. We have many myths, such as if you have a heart attack, start to cough, and they call it cough CPR. It's a myth. We don't have cough called CPR cough. It's a myth, guys. So when you have start to cough, if you have start to have signs of heart attack and you start cough, you what they call, we make the heart more stress. You make yourself more stress. No. In first aid of the heart attack, make sure the patient stay calm and rest. Immediately, you need to call 911 because in this heart attack, there is no blood supplies to the heart muscles. So there is no blood supplies, the heart muscle will start to die. So time equals muscles, time equals muscles, and will make it worse. So you need to call immediately and you ask somebody to get the first aid kit and the AED. Now, the person, you need to ask him if he has any allergic from aspirin or he has no serious bleeding or signs of a stroke. Okay, we'll talk about the stroke later on. But you need to make sure that he is not have any allergic for aspirin or signs of bleeding or no signs of a stroke. If he is not, he said, no, I take aspirin every time, you just give him one adult aspirin to show it. Don't swallow it. He need to show it and drink it with water, or 2 low dose aspirin. It's called baby aspirin. He need to show it and drink water on it. It's big difference when you give him aspirin in this case. But if you have a doubt that he has allergic or he has serious bleeding or you don't know what to do, just avoid to give anything. Just when emergency come, tell them that I didn't give anything. But if you are sure, just give him aspirin, 1 adult or 2 lows aspirin. Now, you are observing the patient while the emergency staff will come. He stopped the breathing. Immediately, you put him on the floor. He need to have on the firm flat surface, and you need to remove his clothes and start CPR. And of course, if there is any ED, you need to use it immediately. Now, what about the stroke? It's the same clot that goes to the heart, it goes to the brain. When it goes to the brain, it stops the blood flow to the brain cells. So this clot will give you these signs. Remember this acronym, FAST. FAST, when you have the patient have a stroke, his face, half of his face, left or right, according where exactly the clots, will be dropping. It will be asymmetrical. Arm, you will see a very weak arm. Speech, he will start to have slurred speech. He cannot give a full sentence or a full word. T, time to call. Immediately, time to call. So if these symptoms occur for anybody by personal, don't wait, don't drive, and call immediately 911. So this is the stroke, the signs of stroke. Now, of course, you need to make sure the scene, this is your first aid, make sure the person stay calm and rest. Call 911 and get the first aid kit and the AED. Now, note the time when the stroke signs appears. Remain with the person until someone will go more advanced training to take care of him. Of course, if the patient is stop breathing, you start for him CPR and use the AED. So this is a stroke. It's a clots in the brain. So why we don't use aspirin for it? It's a common question. In the heart attack, I give aspirin, but in the stroke, it's a clot. I didn't give aspirin. Why that? Because if there is a stroke, that's mean a clot in the brain, or there is a hemorrhage or bleeding inside the brain, we cannot tell. How we can tell? When we send them to the emergency, we send them to the CT scan, X-ray, and we notice that it's a clot or it's a bleeding. And most clot and the bleeding, they have the same symptoms, signs and symptoms. You have fast. So what you don't know what exactly happened to his brain. If he has a bleeding and you give him aspirin, what happened to the brain, to the bleeding, become worse. So only just call and no time with the stroke sign appears and wait the emergency when they come. If God forbid he stop breathing, start CPR and use the AED immediately. What about the diabetic? Diabetes, it's a disease that affects the level of sugar in the blood. Too much or too little sugar cause a problem. Some people with diabetes take medications such as insulin to maintain their sugar levels. Low blood sugar can occur if the person with diabetes has not eaten or is vomiting, has not eaten enough food, or his level of activity is more than less than he took food, or he inject himself too much insulin. He have double dose. So when we have low blood sugar, what is the signs of symptoms of low blood sugars? The signs of symptoms, the patient become irritable, confused. He feel hungry, thirsty, or weak. He feels sleepy, sweaty, seizure. Sometimes it will lead to seizures. This is low blood sugar. That's mean there is no power in the man, in the patient. There is no power. He is really hungry. He wants to elevate the sugar level. He is sleepy. He is very sweaty. Okay, all these signs and symptoms tell you this man have low blood sugar. How to first aid him? Now, how to assess? We need to assess the person. If the person can't sit up and swallow, if he can sit up and swallow, ask him to drink or eat something with sugar. Or you give him date, you give him honey, you give him packet of sugar or paste of sugar, whatever contains sugar, give it to him. If you want to give him cola drink, okay, Pepsi drink, but should be regular, have a sugar, not diet one, okay? Anything contain drink, sugar, give it to him, okay? But if he cannot sit up and swallow, don't force him, especially the kids. Because when you force him, they will start to vomit and make things worse. Have that person sit quietly and lie down. If he is not become better within 15 minutes, immediately you need to call 911. There is another question. What to do if you are not sure if the person has low or high sugar? We have two options. We have reliable option. That means you ask the patient. People with diabetic, they know themselves when their sugar is high or low. You ask him, what happened? I'm not feeling you normal today. He said, yes, I eat my food, but I didn't have my medication yet. That means he have high sugar. Or I took my medication, but still I didn't eat yet. I am busy with my work. That means he has low sugar. Okay, so your reference will be, in this case, the patient himself. Okay, the second one is you need to use the glucometer advice. So this glucometer machine, you take from him a blood sample and you think it's low or high. According to that, you respond to him. But in case he is confused, he cannot give you any correct answer. He is confused. And you don't have the glucometer check device. What you will do? Give the sugar. Give him the sugar. The bottle of sugar will increase the blood level, for example, 30. Okay. Now our blood sugar level in the normally will be over 60, 70. Okay. If somebody has low blood sugar, and you give him a drink of juice, now he is 40, and you give him a drink of juice, he becomes 70, back to normal. But if he has high blood sugar, for example, 300, now if you give him a sugar and become 300, 330, doesn't make things worse. But what is your clue? After you give a sugar After 1 or 2 minutes, the patient, if he stays the same, that's when he has high sugar level. But if he start to be more alert and become back to his normal, that's when he is low sugar. And of course, you need to call 911 and stay with the patient. So this very important, and many important things. When you give somebody have low blood sugar, you give him juice or something to rise his sugar level, you need to make sure that he is maintain this level. How you will make sure? He need to have a meal. You need to give him a meal, provide him a meal to maintain his sugar level. Otherwise, maybe the sugar will go down again and you are not around. And it happens. So guys, listen to me. Make sure that once you give him and rise his sugar, you maintain his sugar level. Okay, and you need to observe him at least 1 hour after you give. Now let's go to the injury emergency. We'll talk about external bleeding facts and first aid. Now, this is facts. Time equal blood. More blood, more time you don't do anything, you more blood you lost. A lot of blood leads to shock, which lead to death. Stopping the bleeding as soon as possible is your main priority. Pressure on the wound, on the bleeding side, it's the main skill to stop any external bleeding. Now, when you help somebody to stop his bleeding, remember this acronym, PPP. Always protect yourself by check the scene, make sure that scene is safe for you and for the patient. What make him injury in the first place, you don't want him to make him re-injure him again, or you'll be the second victim. So scene should be seen safe for you and the victims. Okay, guys? And you need to use your PPE, your personal protective equipment. If you don't have, use whatever, any barrier. Don't touch his blood by your hand. Never touch his blood. So make sure that you wear your PPE, your gloves, at least your gloves. And if you don't have a gloves, use anything as a barrier to protect you from his blood. Pressure, always pressure by yourself. The victim, especially children, they are panicking, they are power, and the victim who lost a lot of blood, his power will be less. All the power, all the pressure should be done by you. As American Heart Association, new guidelines 2020, they said if you find the bleeding is very severe, immediately you use the tourniquet. The tourniquet, that's mean you put above the hand, it's bleeding, gauze and fabric cloths, and you make it with the screwdriver wherever something is rigid and not easy broken, and you start to twist until you stop the bleeding. And of course, once you stop the bleeding, you need to protect the area by using the bandage. Now, let's go to the last topic we have today. It's cardiopulmonary resuscitation, CPR. We'll talk about the facts. We'll talk about the compression rules, chest compression rules, giving breath rules, how to start CPR, when to stop CPR, and using and hands-only CPR technique. Now, CPR facts. CPR is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest. High-quality CPR has two main skills, chest compression and giving a breath. The ratio of CPR is 30 chest compression and 2 breath, which called cycle. Any rescuer should do 5 cycles equal or 2 minutes of CPR before he asks somebody to take over from you. Now, chest compression, the most important thing, because this is an effort, you do an effort. You need to know that your hand location in a proper way. So the right hand location is in the center of the chest, in the lower half of the breastbone. When you put your hand, not all your hand, only the heel of your hand, this area, the heel of your hand, you put it in his chest. You need to make sure that you lock the position by you put the hand over the hand like this. So when you start CPR, you need to use all your body weight to do the CPR, because you need to be deep enough, at least 5 centimeters or 2 inches. At least that means go harder. Your rate, come and up, down and up, down and up, should be 100 to 120 compression per minute. That means if you are perfect, every second you will do 2 chest compression. Once you do the chest compression, you need to count loudly, because we need to rely on this count. 1, 2, 3, 4 until you finish 30. But when we use the AED, we will talk about it next slides. AED, it has this privilege. He will give you the rhythm. He will give you the beat. Just follow the beat. But if there is no AED, you need to count loud, or at least the helper who is helping you he can hear you. Of course, when you pump the blood, pump the heart, you need to make sure that he is but come back again to the normal position. Why? We need to make sure that the heart is refilled totally with the blood, though, to push it again. If you didn't do that, you are squeezing the heart. You are not pumping the heart. And of course, the most important things in the CPR is chest compression. So we are ready to interrupt compression. If you interrupt it, it's no more than 10 seconds. The second skill, which is giving a breath. We give the breath when we open the airway, by tilting the head back and lifting the chin. And we avoid to pressure the soft part of the neck. Of course, when we give them when we open the airway and we start to give a breath, we need to use the barrier device. In this case, bucket mask or face shield. And of course, how you know you give the effective breath? You see the chest will, when you give a breath, the chest will rise. Otherwise, something get wrong. Even your skills is not proper, or you didn't open the airway in a proper way. So this is the giving breath. When I said the optimal CPR, it contains from 2 skills, chest compression and giving a breath. This is the high quality CPR. But in this pandemic, we cannot do that. We need to use the other technique, which is called hands-only CPR. Hands-only CPR, that means you put your hand on the chest and you start to get chest compression. No need to count loud. No need to count loud. Just go with the rhythm, stay alive, stay alive. And you, every 2 minutes, you ask somebody to take over. No interruption for breathing anymore. I will repeat this again in the next slide. Now, as I told you, no breath, only chest compression. Highly recommended during the COVID-19 pandemic. Continuous chest compression, no need to count. The rate is 2 compression per second, follow the song rhythm. And of course, change rescuer every 2 minutes. So no need to give him rescue breath. Just do this one until the emergency will come. Now, how to start the CPR when you remember how to find the problem? Everything is the same, but in this case, he is not breathing normally, only gasping, or he is not breathing at all. His chest is flat. Nothing goes up or goes down. There is no movement. In this case, immediately you start CPR. And of course, I'm emphasizing, if you confuse he's breathing, not breathing, or not breathing, just consider him not breathing and do for him CPR. Don't worry. You cannot harm him. If you do CPR for him, if he doesn't necessary, but really you harm him if you delay the CPR for him. Now, when I stop CPR, I start CPR, me and my friends, until the emergency will come. person start to respond again. When you start to see the person is response, or he move his hand, or he open his eyes, that means he is back. So stop CPR. AED machine, when you put it in the chest and analyzing the rhythm, inform you no need for CPR. You stop the CPR. Medical team, the emergency team will arrive and takes over. You stop CPR. And once you start to be tired and weak after a long time of doing CPR, and there is no obvious change. So when you are fatigued and you cannot do high quality chest compression, when you are weak, you cannot do that. When you are tired, you cannot do that. So stop doing CPR, because you are not in the same rate, you are not in the same depth, you are just wasting your energy. So when you have long time of doing CPR, there is no obvious change, you can stop do CPR. Of course, the scene become unsafe, either you or the victim. So you need to move the patient out to the safe place, or you move away from him. Now, what about the automated external defibrillator? It's a device that automatically analyzes the heart rhythm, and if it detects a problem that may respond to an electrical shock, delivers the shock and to restore normal heart rhythm. So it's very, very safe, very safe device. This device between people, it's in the code of the buildings. Safe, accurate, easy to use. CPR with AED give the best chance to save life. Cardiac arrest mostly happens when the heart starts to quivering. That's what they call it, an automated external defibrillator. Fibrillator, that means the heart is quivering, it's shaking. When you give them a shock, it maybe will start again to the normal beat. Also, the AED, as I told you, it's a mandatory. Now it goes in the building code. It's before it was high recommended. Now it's become mandatory in any public areas like stadium, airport, large companies, and etc. So using the AED, so there is many kind and what they call shape or manufacture. They are produce AED. They are have AED in the market. How I will deal with them? If anybody have different? No. Remember the car, you have your driving license, different car, different key, less key remote with the manual, but the same principle. All the AEDs is the same principles, but you need to remember these rules to operate any AED. First thing, you need to use it immediately. Immediately. When AED come, you need to use it immediately. Unless the man who is bring the AED, he knows how to operate. In this case, the chest compression is your high priority. Okay, guys? So when you use it immediately, that means you run the power. Even you put the LED on, you go hit the button, you have the key, whatever, make it run, make it run. Second rule, listen carefully to the prompts. There is audible prompts, sometimes visual prompts, tell you exactly what to do. He will tell you, move the bats and put the bats as it shows. The bats itself, if there is a picture on it, tell you exactly where to put. Try not to miss. Try to put it in the correct place. Okay, once you put the bats in a proper way, the machine will tell you analyzing rhythm. In this case, you need to stay away and make everybody from the bystander stay away from the patient. Make sure that nobody touch him. The machine need 10 to 15 seconds to analyze the rhythm of the heart. So there is a three scenarios. Even the machine will tell you no need for CPR. That's mean the heart is working normally. Or he will tell you start CPR. That's mean the heart is completely stopped. Or the heart is quivering, that means he needs a shock. So he will tell you, advise you to shock. So before you give the shock, you need also to set clear. Don't touch the patient, and nobody will touch the patient. Then you shock the patient. Once you shock the patient, and the machine told you shock advice, shock delivered, you start to do CPR immediately. Now, in this case, you go with the prompts with the AED. Sometimes he give you a beat. Then sometimes he give you a beat to work on it. Don't not count loud. Just go with the beat. Now, every 2 minutes, this machine is designed to reanalyze the heart rhythm again. So whatever happens, never ever switch it off or remove AED bags. The only who able to do that, only the emergency team. So every 2 minutes you are doing CPR. After 2 minutes, the rhythm will be, the machine will tell you stop CPR, and the machine will reanalyze the rhythm again. If he needs another shock, you give him another shock. If the heart come back again after the first shock, he will tell you no need for CPR. This device is very smart. It will not give a shock and activate the shock button unless the patient doesn't need a shock. If he needs a shock, it will be activated. Otherwise, will never be activated. This machine is very safe and easy to use, and it is between the public, so it will be very easy to operate. Now we finish our webinar today. In this webinar, we talk about the webinar day, the first aid day, and we talk about finding the problem, the primary skill of the first aid. We talk about injury, medical emergency such as heart attack and stroke, and also we cover the injuries, bleeding, external bleeding. We talk about CPR and the main function and the facts of CPR and the main skills in the CPR, and how to perform hands-only CPR, especially during this COVID-19. And we talk about the AED, the automated external defibrillator, the most important machine device. I am really highly recommend you to learn about it, see about it. There is many American Heart Association videos in the YouTube. You can go and check it on it. This is my time, and thank you.